You can't Dr. Google yourself well. If you've had a chronic disease for any amount of time, you've probably already learned this. Most people, when they have a health challenge, they first go to Google and they try and research on their own to figure out, hey, is there a simple fix? But chronic disease isn't fixed simply by Google. Dr. Google can't help you when you have a chronic disease because by definition, chronic diseases are complex. And the complexity isn't going to be figured out by a Google search, just like the complexity often isn't figured out by a visit to a conventional medical doctor's office. Because both Google and conventional medicine are built on algorithms that take you from here down a little flow chart to an end result. Well, humans don't follow flow charts. Humans are not textbooks. So each person, if we have 10 people with the same chronic disease diagnosis, all 10 of those people have different puzzle pieces making up that diagnosis. And therefore, they need detective work specific to them to have an individualized and specific plan created to address their issue. Today, I want to take you through a case to show this complexity to you and help you understand why you cannot Google yourself well. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. If you have a chronic disease, you can't Google yourself well, or Dr. Google is not going to help you. And the reason for that is that the chronicity often leads to complexity. The more chronic it is, the more complex it is, because over time, as you've stayed unhealthy and your physiology has become dysfunctional or deranged, more problems occur. So it's hard to do a 7-minute exam in a conventional medicine doctor's office or to do a quick Google search and account for all the things that have gone haywire. And therefore, there's not one drug to address that. I want to show you that on the whiteboard today. Here's a case of a 20-year-old female with chronic back pain and chronic headaches. They've been going on for over 7 years. She's seen multiple doctors, hasn't been helped by any medications or anything that's been done for either the back pain or the headaches. So she presented in my office. I went through a thorough history, medical record review, exam. We did labs. And now that we have the lab results, I want to show you the web that I drew for her and her family so that you understand the potential complexity of your case if you're a chronic disease sufferer. Again, she's chronic back pain and headaches. So we'll start off by saying that chronic pain is going to be due to inflammation. And so if you're in chronic pain, you're chronically inflamed. Well, chronic inflammation anywhere in the body could ultimately result in neuroinflammation and drive headaches in and of itself. So that could be one cause of her headaches. One cause of headaches could be elevated homocysteine levels. Homocysteine drives oxidative stress, or say rusting of the body, and homocysteine is a known risk factor for cardiovascular disease and dementia. It can promote excitotoxicity, or neurons dying or functioning suboptimally, and that could result classically as brain fog or headaches. It happens that this patient had high homocysteine, and homocysteine is a byproduct of methylation in our body and can be recycled if we have healthy levels of folate and many other nutrients, but folate's a big one because it runs the MTHFR gene. The gene requires that to function. This patient had low folate. So low folate leads to poor recycling of homocysteine, buildup of homocysteine, increased oxidative stress and excitotoxicity, headaches. Another potential cause of headaches is sex hormone imbalance. This female, 20 years old, had estrogen dominance. Estrogen dominance can contribute to headaches. Estrogen and histamine are connected physiologically. Histamine can drive headaches as well. So maybe high estrogen related to high histamine driving the headaches. This patient also had low B12. Vitamin B12 functions in the methylation cycle to recycle homocysteine, but vitamin B12 is needed to make the myelin sheaths that are the sheaths that cover our nerves. So when signals are conducted down the nerve, they're bouncing along the nodes between the myelin sheaths. So if we don't have B12, you can have fatigue, but you may have cognitive dysfunction and headaches. So those are some of the things that contribute to the headache picture. Another one is this patient had low iron. Iron carries oxygen, and oxygen becomes energy. Oxygen is one of the 3 necessary fuels for the brain, also glucose and stimulation, movement, exercise, learning. If you have low iron and you're not delivering oxygen to the brain properly, then the threshold of firing for brain neurons is lower, and whatever your weak link is could manifest more easily. In this case, headaches. So low iron can be driving headaches. Low iron is also inflammatory. So if you have low iron, again, the body isn't receiving the oxygen it needs. That's called hypoxia, and hypoxia promotes inflammation. So low iron can be promoting inflammation and promoting her chronic pain, her chronic back pain. Another thing that can promote chronic pain is chronic stress. And chronic stress, let me erase, I'm going out of order. Another thing can be low cortisol. Low cortisol can promote chronic pain because cortisol is one of our most powerful anti-inflammatories. So if you're lacking your anti-inflammatory, you're more inflamed. Inflammation drives chronic pain. So she has low cortisol, and that's due to the chronic stress. Chronic stress ultimately can create cortisol resistance or low cortisol and result in increased inflammation. Chronic stress, as I've covered in other videos, can promote brain inflammation, and that brain inflammation can result in headaches. High systemic inflammation exacerbates pain. So you could have pain because of physical injury, which is part of her case. She was a gymnast, so part of her pain is related to physical trauma and repetitive trauma. But then if you're metabolically unstable, if you have metabolic inflammation, if you're systemically inflamed, that piles on to the pain. So metabolic inflammation can be a driver of pain. You could have pain because of neurological cause, so central sensitization, okay? So one thing metabolically, a metabolic driver of her pain is her lab high C-reactive protein. That's a systemic inflammatory marker. We know her whole body's on fire. That's contributing to her pain. Another thing that can contribute to pain is low vitamin D. And she had deficient vitamin D. Vitamin D is one of our best anti-inflammatories. Again, if we're not putting fires out, there's more fires, more pain. Vitamin D also, again, can help squash neuroinflammation. So if we're not putting the brain fire out, she can have headaches. Vitamin D functions in dopamine signaling. So if dopamine signaling is aberrant, she may have mood issues as well. Now, the chronic pain and the chronic inflammation can result in thyroid receptor insensitivity. And this person is dealing with this, meaning she is producing enough thyroid hormones. Her thyroid hormones in her blood are optimal, but the TSH is still high. That suggests that the blood levels of the hormones are not binding the receptors and creating the metabolic response inside the cell, so we have insensitivity there. That can be driven by inflammation. That can also be driven by chronic stress. Chronic stress decreases thyroid function. This patient also has lab low vitamin A. Vitamin A is anti-inflammatory, so not having it promotes inflammation. Vitamin A is necessary for thyroid physiology, so that could be promoting the suboptimal thyroid function. Vitamin A is needed to make secretory IgA. And secretory IgA are the antibodies anywhere we have mucosal surface, sinus, gut, lungs, bladder. So if we're lacking secretory IgA, or SIG-A for short, then our mucosal defenses are suboptimal and susceptible, and maybe more things from the outside are getting in. So that could promote leaky gut or leaky sinuses, leaky lungs, okay? And SIG-A production requires vitamin A. Thyroid receptor insensitivity could lead to her low SIG-A because T4 hormone is key to mucosal immunity, okay? Her low SIG-A could be driving her headaches. Recent research says that low gut levels of secretory IgA can promote brain inflammation because the SIG-A from the gut has been shown to hop into the systemic circulation and go up to the brain to act in an anti-inflammatory role. So if we're deficient in that in the gut, its effects in the brain also are likely to be impacted, promoting brain inflammation, which in this patient is likely driving headaches. This person did not have GI complaints, no gut complaints, but on testing, we found that she had gut dysbiosis. And gut dysbiosis is a fancy term for imbalance between good bugs and bad bugs. She had overgrowth of bad bugs, and her probiotics were actually sufficient. She has enough probiotics, but the bad bugs were overgrown enough that the probiotics weren't enough. Deficient SIG-A also promotes this. By not having robust barrier defenses, more things enter the gut, so it's easier for the dysbiosis to occur. The low vitamin D promotes gut dysbiosis because vitamin D functions to keep your gut barrier tight or prevent leakiness. So low D promotes gut dysbiosis, and gut dysbiosis promotes gut inflammation. Calprotectin is the best marker for gut inflammation, and hers was lab high. So high calprotectin promotes gut inflammation. The gut inflammation promotes chronic pain, and you're off to the races there. Now, lastly, this patient also suffers from insulin resistance. And insulin resistance means you're not going to be handling your blood sugar well. Insulin resistance also promotes poor vagus nerve function. And the vagus nerve drives gut motility, so making sure things are moving through. You're not having diarrhea, but you're not constipated. It drives digestive enzyme secretion. It drives stomach acid production. And it's a major anti-inflammatory stimulus to the gut. So it can help put gut fires out or prevent them from starting. Well, if you're insulin resistant, insulin is a big time inhibitor of vagus function. So the insulin resistance can be promoting gut issues via the vagus effect. And then the vagus is the parasympathetic nervous system, a major part of it, and that inhibits the sympathetic nervous system, which can drive headaches. So the vagus would be inhibiting that or helping prevent those headaches. But the insulin resistance blocks that inhibition, which means the headaches are promoted via vagal inhibition of inhibition. A double negative is a positive, right? So my question for you is, what medication is going to correct this? What are you going to search on Google to correct this, or to even find this out? Nothing, right? There's not a drug for all of this. You may notice that many nutrients are lacking. How many doctors do you think she saw? And of those doctors, how many do you think checked anything in her nutrient status? None, right? Well, one ran a serum B12, not a great marker. It was lowish, but within normal range, so doctor didn't pay attention to it. Okay? So these are things that have to be found by a detective, and the clinician needs to know to even look to these things to find these. So The Google algorithm isn't going to find this out for you. The typical conventional medical doctor in a 7-minute visit, A, probably doesn't know this stuff. B, doesn't have time to look for it. C, it doesn't fit the conventional medical model to look for this. So if you're suffering from chronic disease, whether it's chronic pain and headaches, whether it's autoimmune disease, whatever it is, Dr. Google's not going to save you. If conventional medicine hasn't helped you and you're watching this video, you're more complex than they're going to be able to help. So you need to find a detective clinician who has the knowledge to know what's involved, the knowledge to know what to look for, and then when they find it, the knowledge to interpret it and understand what it means in your specific case, so that an individualized and specific plan can be made for you so that you can return to a life at optimal.